Dr. Claudia Garcia-Moreno is the head of addressing the needs of vulnerable populations at the WHO's Department of Sexual and Reproductive Health and Research. She coordinated the WHO study on women's health and domestic violence, and she joins us now from Geneva. Thanks so much for being with us. You know, some of the statistics I have to say, that surprised me most were, for example, the highest rates of abuse by a partner were actually among 30 to 39-year-old women. I'm shocked at that, because why would a more mature group of women be so vulnerable to such types of abuse?
I think that the violence, the thing that surprised us more was that this form of violence, particularly in intimate relationships, starts so early. We saw that already among adolescent girls, 15 to 19-year-olds. We have 24%, so 1 in 4 of them are already have experienced at least one form of sexual or physical violence in an intimate relationship. And of course, we have to remember that there are about 12 million girls in different parts of the world that are already married before the age of 18. Once you've highlighted the particular age group, but in fact, once it starts, it stays relatively at the same prevalence between 26, 28%. So it is really the women in reproductive age starting from 15 to up to 49 where we see the highest prevalence. And there are some variations, as you point out, but not in a significantly different. We see a slight reduction in women after 50, but we also have to keep in mind that there is less data for older women, and older women may still be experiencing abuse by a partner, but also start experiencing violence in the hands of caretakers or children. So the patterns may shift. But really, we would highlight that it starts early and it stays relatively constantly high throughout the reproductive years.
Right. Like I said, so much of this report was really shocking and disturbing, and there's so much information in it. The focus, though, of the study was actually on physical and sexual violence, but surprisingly, the WHO said, rates would be much higher if online violence and sexual harassment were included as well. How much worse could it get?
Well, we have also been collecting, as part of the data gathering, data on psychological violence by an intimate partner. But we have less clear standards on how to measure this across cultures. And this is one thing we will be looking into. We know from women's own reports and from data that psychological abuse also has impacts on women's health and well-being. So this would definitely increase the rates overall, and we will be looking into it. I can't tell you exactly how much it will be. But again, as you highlight, this report only looks at 2 forms of violence against women: physical or sexual violence by an intimate partner and sexual abuse by a non-partner. But there are myriad other forms of violence that women and girls are exposed to, including, as you've pointed out, sexual harassment. There's trafficking. There is many other forms of violence that are at the moment not being captured fully.
Tell us then, what are the potential solutions?
So violence against women has been shown to be preventable. We know a lot more about prevention than we did even 5 years ago, and we know that there are interventions that can work not in decades but in years, and they include a range of everything from school-based programs that are challenging gender stereotypes and comprehensive sexuality education and fostering relationships based on equality and consent, to community-based programs that also are challenging norms around the acceptability of violence, to ensuring women's access to secondary and higher education, ensuring paid and safe employment for women, to the social environment, the laws, and the policies that we need to change so that they don't discriminate against women. So we really need to act at many different levels and across sectors. We also need to ensure that services are available for those who need it, and services can be also important in terms of early identification and preventing recurrence of violence.
Okay.
One last point maybe to mention is that preventing child abuse in childhood, preventing violence against children is also important because we know that it is one of the factors that contributes to later violence in life.
Absolutely. Dr. Claudia Garcia-Moreno, thank you so much for joining us there. We appreciate it.